everyone. Welcome to The Doctor is In, your daily guide to virtual care in this time of the coronavirus. I'm Dr. Freddy Gomez, and together with our guests, we're looking forward to answering your questions. There is no cure or vaccine yet for COVID 19, but scientists all over the world are working to develop vaccines and other treatments. And that is our topic for today. Pero paano nga ba nakakatulong ang vaccine para malabanan ang COVID 19? In the meantime, while we're waiting for a vaccine, we want to emphasize the importance of social distancing and good personal hygiene. And with restrictions easing, we should always remind ourselves individual behaviors matter. Respect for others. Importante yan. Sabi nga nila, behave like you have the virus. On this show today, we have Dr. Endymion Irvin Tan, who specializes in infectious diseases. Welcome to the show, Doc Andy.
Hello, yes, good afternoon. Hello. Hello, yes, good
Hello, good to have you
afternoon,
on the
Dr.
show again,
Freddy.
Andy. Y-
Yeah.
yes, good to have you on the show. Now, Doc Andy, there are more than 100 vaccine efforts underway globally. Could you share with our viewers how vaccines work in a general yet scientific explanation?
Okay, so generally, actually, vaccines, we have two types, no? So when you're talking about vaccine, this is something that you give to your body to give you protection against diseases, okay? So we have what we call the passive immunization. So when they say passive immunization, these are in the form of immunoglobulins, when you give this drug to a person, because this is already a preformed antibody, or what you say, a preformed protection already, a passive one. But the duration of protection is, of course, shorter and it is less robust. As compared to the other type would be the active immunization. When we say active immunization, you are giving this vaccine or vacuna to a certain person because you want to let this person's own immune system to mount an antibody response. So this is an active type of immunization. So this would render a longer duration of protection and a more robust protection against diseases.
Now, whether it be the active or the passive way, will a vaccine provide total immunity against the virus?
Okay, so actually for any diseases, okay, in this world, there's actually no absolute thing in medicine. So vaccines would really help, but they cannot give you 100% protection. So hindi siya 100% protection even if you are vaccinated. But somehow those would really help in preventing diseases.
Now, we also know that developing a vaccine takes months or years or even decades, as with the case with the HIV virus. What can we expect in the next few months in terms of a vaccine being found that is safe and reliable for people to take?
Okay, so are we talking about any particular vaccines or not? But actually, for vaccines to work, actually,
No,
these
the progress
medications
that we
or these vaccines, yeah. So vaccines
in
against
developing
COVID,
a
if you're
vaccine for
trying.
COVID-19.
Okay, so actually vaccines, no, they really need time, okay, because we have to undergo trials, okay, so therapeutic trials. So we cannot just give any vaccines or medications to the humans, no. So ethically, they might not be very sound. So in the next few months, I'm not seeing right now that we'll be having this vaccine, not to prevent this COVID-19 infection or this COVID-19 disease. But actually, there are certain ways on how you can actually prevent this disease. It's the hygiene, right? And the social distancing and isolation, actually.
That's right. Now let's answer some questions from our social media viewers. First one is from Alex Ryan.
Okay, sure.
Why is it taking so long to approve? Why is it taking so long to approve a treatment for COVID-19 when many people who are infected have gotten better already with certain treatments?
Okay, okay. I think there's artifact. Okay, hello. Hello.
Hello, yes.
I think there's artifact yata in the background. Anyway, so what's taking so long? Actually, this COVID-19 is a viral infection. Okay, so the difference is usually most of the viral infections result really the number of
Okay, we're losing Dr. Andy over there, but with regards to the question that Dr. Andy was asking, hello, Dr. Andy, are you back?
Okay, yes, yes. I think my artifacts, John, I think
Okay,
in the background. Okay, no, okay. Okay, so actually, since this is a viral infection, the dictum is almost all viral infections do not really need any drug of choice or cure because they're said to be self-limiting. But for this COVID-19, yes, we do not have the proven drugs yet to treat this kind of infection. But of course, we have some algorithms that we follow, and we have some novel treatment approaches like giving of certain drugs, certain non-pharmacologic treatments, okay, like hemoperfusion, plasma, the convalescent plasma transfusion, okay. So some anecdotal um, experiences or papers have shown that they are said to be effective, but not really parang proven with RCTs or yung mas higher level of trials. But we do give those drugs actually, and we have a good outcome in our patients.
before we go
Excuse me.
before we go to our next social media question, I'd like to show you promising efforts by one company to develop a vaccine against COVID-19.
As the world works to find a safe and effective COVID-19 vaccine, manufacturer Moderna says it is seeing promising results in human trials.
These are really good news for us and everybody that's been watching for this day.
The biotech company, in partnership with the National Institutes of Health, measured antibodies in 8 people it vaccinated, and all 8 developed neutralizing antibodies.
These antibodies were proven to be able to block the ability of the virus to infect cells. We are already seeing an immune response at the level of people who've been infected with this virus and are believed now not to be susceptible to further disease.
It's encouraging, but we still don't know if people who have been infected with the virus are immune from it in the future. So it's not clear whether vaccination will provide total immunity. So far, Moderna has vaccinated between 60 and 100 participants. Starting in July, the company plans to begin to conduct large-scale clinical trials, which typically consist of tens of thousands of people. If those studies are successful, the company hopes to have a vaccine on the market between January and June of next year.
This is really a very first important step in the journey towards having a vaccine available for the people who need it the most.
As researchers work at lightning fast speeds, medical experts caution it may be some time before a COVID-19 vaccine is perfected.
If you are going to to work out a perfect vaccine, it will take years and years.
In Washington, I'm Karen Kafa.
Very promising news over there from the drug company developing the vaccine. And if ever that is successful, that would probably be the quickest vaccine turnaround that we have today. So we have to pause for a quick break, but when we return, let's take a look at antiviral drugs that are being used to treat COVID-19. Hello, I'm Dr. Freddy Gomez, and welcome to The Doctor Is In. We want to make the most out of your telemedicine appointment today. So send in your questions and we'll do our best to answer them. Thank you very much for joining us. So ang paggamit ng antiviral drugs ay isa sa mga paraan para labanan ang COVID-19. Pero gaano nga ba ito ka-epektibo? Here to talk about this is Dr. Edimion Tan, who is an internist and infectious disease specialist. Now, antiviral drugs don't kill the virus. Instead, they limit the production of new viruses in host cells. So the best these treatments can do is shorten the duration of the illness and lessen complications. Since COVID-19 is new, Dr. ND, what treatments are being tested right now for COVID-19?
Okay, so right now, so we have algorithms that we follow for the treatment of COVID-19 pneumonia or the infection per se. So some of the drugs, okay, so they have the use of hydroxychloroquine. So hydroxychloroquine actually is not an antiviral per se. Actually, this is an anti-malarial drug, okay, and this is also used to treat persons with immunologic problems like SLEs. But studies have shown, not really very robust studies, okay, some of those trials or some of those experiences, especially amongst the French, actually, no? So because there are certain French studies that they are using hydroxychloroquine combined with the azithromycin, and they said that it's effective in treating this COVID-19. Another antiviral drug would be your lopinavir and ritonavir. So this is basically what we call a protease inhibitor. Okay, so this is usually used to treat HIV type 1 infection, but of course this is given with another drug. Okay, but this lopinavir ritonavir, what it does to this COVID-19 is it will increase the pH or the acidity alkalinity of the host cell genome so that it will somehow prevent the binding of the virus. Okay, so the Chinese people, I think the Chinese doctors here, okay, so when we had a meeting before, so they are quite fond of using this lopinavir ritonavir, and they have their research, what we call the Lotus study, which use the lopinavir ritonavir as the antiviral of choice to treat this COVID-19. And another drug is the remdesivir. Actually, this is again an investigational drug as of now, a novel approach, but still we do not have it yet here in the Philippines. Actually, just so you know, and our audience would know, this remdesivir is an investigational drug used to treat Ebola virus infection, actually. So I think the one shown there in
Okay,
the screen, the
Doc Andy.
Kalecha, yeah, yes. Mm-hmm. Hello,
Yes, Doc
yes.
Andy, all those drugs you mentioned, I believe, but most of the drugs were off-label. When a drug is planned to be used off-label, what should our viewers be concerned about?
Okay, so if a drug is said to be off-label, this is not really used for this indication. But if this is off-label, we should have the consent. Of course, should ask the permission of the patient if it is okay for us to use this drug. We have to explain to them the possible adverse effects or side effects with this drug. Because example, with hydroxychloroquine, okay, so we should be monitoring the ECG of our patient. We should be telling our patient that we have to do ECGs on them every day because we have to check for what we call the QT interval because it can lead to cardiac rhythm abnormalities, okay? So nagiging irregular, pwede maging irregular yung tibok ng puso, okay? So irregularities in heart rhythm. And another adverse effect with hydroxychloroquine is you can have neurologic side effect. They can also have ophthalmologic side effect with retinopathy or retinitis. And with lopinavir, ritonavir, this is again an off-label use for treatment of COVID-19. And the most common adverse effect or side effect that we have to tell our patient would be gastrointestinal side effect like diarrhea. So those are some of the adverse effects that they have to watch out
Okay,
for. Yeah.
right. Uh, right. And Andy, let's answer some social media questions because a lot of people are sending in their questions. We have one from Kay, and she's asking what treatment right now is the most common and promising for COVID-19.
Okay, so actually for the treatment of COVID-19 pneumonia, we do not just use pharmacologic treatment. Actually, personally, I'm a very fond of using both pharmacologic and non-pharmacologic approach, okay? So with pharmacologic approach, so we use hydroxychloroquine, or in some cases we use lopinavir, ritonavir, and we have some other drug also, but not really used for the treatment of COVID-19. But one of the pathophysiology or the reasons why you have the complications, the pulmonary complications is we have the cytokine storm. It's like your immune cells are going berserk, they're going crazy, okay? Like a hyperinflammatory state. So we can give this patient some drug that can suppress, okay, those cytokines like the interleukin 6 inhibitor personally a favorite of mine, which is the tocilizumab. And some non-pharmacologic interventions, meaning to say this is not a medication, but these are non-medication approaches, like doing hemodialysis, using the hemoperfusion cartridges. So actually, I have a very good outcome among my patients using hemoperfusion and the tocilizumab. Okay, so actually they would have a very dramatic improvement in their chest X-ray. They have very dramatic improvement in their clinical appearance and outcome. Actually,
Okay, we have another question from Lynn. Meron po bang antiviral drug na ginagamit na sa Pilipinas? So I guess you mentioned that. You mentioned a few actually, Dr. Andy.
yes, I did. So Dr. Freddy, so for our audience, so yes, we do have lopinavir, ritonavir that we give to our patient, and other non-antiretroviral drug like the hydroxychloroquine we also have, and the tocilizumab we also have it here. What we do not have right now would be the remdesivir as of now. Okay. And I think our audience might also be curious because they might have been hearing the Tamiflu or the oseltamivir. Actually, the oseltamivir, yes, it is an antiviral drug, but usually the oseltamivir is effective against influenza infection, but not really for corona.
Thank you very much for joining us, Dr. Andy. Your insights have been very helpful.
Thank you very much.
And remember also, while the world is rushing to find a vaccine, maintain social distancing, at least 1 meter apart from one person to another. Also, back to basics po tayo. Hand washing is important. Use soap and water and wash your hands thoroughly. And finally, wear masks. More than anything, it's about protecting others. So I have to pause for a break, but when we return, we take a closer look at a new research regarding COVID-19 and genetics. We'll be right back. Welcome to the Doctor's In. This program is your daily telemedicine guide in this time of the coronavirus. A discussion has emerged about how the severity of the coronavirus may differ in patients due to their DNA makeup. May kinalaman din kaya ito kung bakit iba-iba rin ang response ng katawan natin sa bawat medication or gamot. To tell us more about this is Cyril Mukherjee. He is the CEO of Life DNA Incorporated, who is conducting research about our DNA and its link with COVID-19. Hello and welcome to the program, Cyril.
Thanks for having me, Dr. Freddy. Good to be here.
Good to have you. Now, Cyril, how can a person's DNA make them more susceptible to COVID-19?
Absolutely. So the research that we're doing here at Life DNA is specifically focused on the ACE2 receptor. So if you think of the ACE2 receptor, think of them as doors. And those doors are present in your lungs. And the coronavirus, which causes the COVID-19 disease, likes to attach to those receptors. So those receptors act as the entry point for the virus into your lungs. And when we're looking at DNA, there are certain individuals that might have more of those receptors in their lungs, so more of those doors, while others might have less. So genetically, if you have more of those doors, there is a higher chance that the virus can go in to your lungs and infect you with COVID-19, as well as the chances of more of those viruses going into your lungs as well. So the research that we're doing here is to figure out which specific populations or groups have a bigger number of those receptors, therefore causing a higher infection rate of COVID-19 as well as a more severe course of the disease itself.
So with what you mentioned, does ethnicity play a role in the impact of COVID-19?
Yes, so we know that different ethnicities have differences in their genetic makeup. Now, this is exactly what we're trying to identify in the study. We know that there is an impact that ethnicity has and DNA. What we're trying to identify is how big that impact really is and which ethnic groups fall in which categories. So part of the research is really focused on specific ethnic groups. And by the end of the study, we hope to have a concrete answer around that.
So could you tell us, Cyril, could you tell us more about the current research on, or the current study that you are undergoing right now? Where are you? Are you close to finishing? I know this is an ongoing study still.
Yeah, so we've identified the specific genes and genetic markers that we want to be focused on and we want to be looking at. We're also now soon going to be in the phase of recruitment. We're going to be recruiting as many people as possible for the study. We're looking for individuals that have either gotten tested for the coronavirus or have not gotten tested. Regardless, we're recruiting both. We're looking for different ethnic groups so that we can have a bigger sample size for the study. So the recruitment phase should be getting started within the next couple of weeks.
Okay, a lot of people, myself included, are definitely interested on the results of those studies. Now, Cyril, if you could help me with some social media questions that people have been posting. We have one from Simone, and she is asking, why are people all over the world affected by COVID-19 differently?
So there are many different factors that can impact your response to COVID-19. So demographics, so your age, gender, if you already have pre-existing conditions. A big one is your nutrition and your lifestyle. So all of those factors have a big impact. But as I mentioned earlier, at LifeDNA, we believe that DNA also plays a really big factor in the response to the virus and the disease. And we hope that with this research, we're able to identify how big that factor is. But all of those are various factors that have a really big impact on why people are reacting differently across the world.
Okay, very good. We have another question from Roxy. She's asking, if a person was infected with SARS before, does that make him or her more susceptible to COVID-19?
Yeah, that's a really good question. And although there's not enough data behind this yet, we have some predictions. Now, if you've already been infected with SARS, the first version of SARS, it might mean that genetically you're more susceptible to COVID-19 because it comes from the same family of viruses. Now, having said that, this might also mean that you have some of the antibodies from SARS that could potentially help you fight COVID-19 as well. So there's still more research to be done around that, but that's the thought process right now in the scientific community.
Right, so at least more studies are needed. So much more questions need to be answered. We have a third question from Quadro. He's asking, is our immune system affected by genetics as well?
Absolutely. Our immune system is largely affected by our genetics for a few reasons. So if you think of your DNA, think of it as the book or the instruction manual that builds you as an individual. It instructs for how proteins and different enzymes in your body are built. Now, sometimes that book has typos. So maybe a word is missing, or sometimes a whole sentence is missing. And when that happens, the enzymes and the proteins can work at half capacity and not at their full capacity. So a good example for that would be the absorption of certain vitamins. So if you have a specific genetic weakness in the absorption of vitamin D, for example, that can have a big impact on your immune system. And it might mean that you need more vitamin D than others, or maybe other ingredients that are going to help you absorb vitamin D better. And if you could take a look as well at a large number of autoimmune diseases like celiac disease, lupus, and even asthma, a lot of those are run from generation to generation. So a big portion of that is genetics. So definitely, genetics have a big impact on your immune system.
Thank you very much, Cyril, for sharing your research on COVID-19. But before we go, would you like to give our viewers a brief message?
Yeah, absolutely. So Although genetics can play a big impact on your susceptibility to the virus, nothing really beats proper hygiene, social distancing measures. Here in Hawaii, we were able to flatten the curve successfully due to the fact that a lot of people essentially stayed home, started wearing masks. You can't go into a grocery store unless you're wearing a mask. So that message is very, very important. We're looking at identifying what causes the virus and what can cause a bigger course of the virus. But at the end of the day, it's extremely important to keep abiding by those rules.
That was Mr. Cyril Mukarzel from Life DNA. Thank you again for your research on COVID-19. And we'd like to also thank our viewers for sending in their questions online. We will see you again on Monday, 3:30 p.m., only here on CNN Philippines. I'm Dr. Freddy Gomez. Stay safe, everyone.